I mean, I was upset with CDC when I left because they stopped tracking people that were infected that were previously vaccinated. So if you didn't track it, well, because then you couldn't report that there were people vaccinated that got infected.
But no, why did they stop tracking it?
But I think there was a decision not to do anything that made the vaccine sound like it didn't work. You know, I've always tried to be honest that I think there was some major mistakes in the vaccines. They should have never been mandated. I also felt that people should have been more honest about the fact that there were side effects to those vaccines, and some people were actually harmed. The other thing I thought there should be, you know, more honesty about the fact that the vaccines don't protect against infection. I remember Biden saying, you know, this is an epidemic of the unvaccinated.
Because what is happening in America right now is a pandemic of the unvaccinated. Let me say that again. It's a pandemic of the unvaccinated. There are about 90 million Americans who are eligible to get the shot, but haven't gotten it yet.
When I was Hogan's chief public health advisor in Maryland after I left CDC, I was saying, wait a minute, 2/3 of the people that I'm seeing infected in Maryland have been vaccinated. I mean, the president of the United States said it. Biden said this was an epidemic of the unvaccinated. Tony wasn't aggressive in putting this in perspective. The CDC didn't put it in perspective. The reality is this vaccine, listen, it's a short duration in which this vaccine provides some efficacy, maybe 4 to 6 months max. You know, if you came down and visited me and interviewed my patients, you know, you'd interview patient after patient after patient that did not have COVID, but are very sick.
Right.
You would say very sick long COVID patients, and it's all from the vaccine. Now, what is it, Chris? Well, it's the spike protein is immunotoxic. All right. When you get infected, it's immunotoxic. But when you give the vaccine, we make the spike protein. Now, this is my opinion. Okay. When I give you an mRNA vaccine, which I helped develop and I've given to a lot of patients and I've taken it myself multiple times, I don't know how much spike protein you make.
Right.
Because I give you mRNA and then your body makes it.
Right.
So you make a little, you may make a lot. You may make it for a week. You may make it for a month. I'm now more of the point of view, and I wish the country would switch more rapidly. I'm more of the point of view, and in my clinical practice, I use the protein vaccine. So I know exactly how much spike protein you get. Your body's not becoming a manufacturing plant.
Right.
Okay. I give you a certain amount of spike protein that's not able to replicate, not able to reproduce itself. And I know the decay curve in the human body. And that's the vaccine I use now. It's made by Novavax. I think it's, in my view, it doesn't have all the nuances that we don't understand about those individuals that looks like there's prolonged production or impact or negative consequence from spike protein in some people that get the mRNA vaccine. It's still rare, but it's real. Was there overreach by the government? I think there's no question about it. I might even argue it got worse in the Biden administration. For example, absolutely never should have mandated vaccines, period. Terrible decision. These vaccines do not prevent infection. They prevent serious illness and death, and those of us at risk for serious illness and death. And that's predominantly those with significant comorbidities and over the age of 60 or over the age of 65. So the rationale for mandating vaccine for healthy firefighters and policemen and the military, you know, and hospital workers teachers was emotional. It wasn't. And it shouldn't have happened. We should have always honored individual choice on those vaccines. Secondly, we should have given more credit, and I tried to argue for this, that, you know, immunity from infection has value too. To say that it was of no value, and we had people who lost their jobs who were immune by infection, short-term immunity, but they had antibodies directed against this virus from a natural infection, and they lost their jobs because they didn't get vaccinated. overreach.
All you Fauci fans need to sit the hell down.